Do you know what is chronic fatigue? Because when we go on the internet, a lot of people are talking about chronic fatigue all the time. But this is really something that on the medical media and on the medical community, some people say like, ha ha ha, that doesn't exist. Some people say it does exist. But it's something that really, when you go and see, people are having these kind of symptoms. So we really need to know what's really going on. Instead of fighting and seeing if it exists or not, we need to go and see if there is something that might be causing some of the symptoms. Is there anything that I can do to prevent having this chronic fatigue? Is there something that I can use to cure chronic fatigue? Is there any good or specific way? Are there really any vitamins related with everything around chronic fatigue? So let's go and review this, and let's go and start talking about this. So chronic fatigue is something that it's accepted by the World Health Organization, and it's also accepted by the CDC as a term, but although it's not accepted in some medical communities all over the world. Why? Because symptoms, because the diagnosis, because the causes, because everything around it, it's not something that you can put together for a lot of people, and that's probably why some people say that it's not true. But again, people really feel chronically fatigued. So let's say that the word or the term doesn't exist, or maybe it exists just to describe that something feels chronically fatigued or chronically depressed or chronically tired or chronically weak. It doesn't matter. What it matters is that people really are feeling this. But with chronic fatigue, there are two kinds of criteria to get the diagnosis. One is the Oxford criteria, but the most used one is the Fukuda criteria. Fukuda criteria says the fatigue should persist or recur for at least 6 months and not the result of an excessive kind of exertion or a big effort. If you're training, I don't know, for a marathon, if you're training for an Ironman, if you're training for something, then you can be chronically fatigued because of the training, because you're working a lot, because you're working a lot at night, because you're doing something else. But if you don't have any of this, and if you have it for more than 6 months, then it's going to be criteria number 1. Or if you have at least 4 of the next symptoms that I'm going to mention for at least 6 months. Problems with memory or with cognition or concentration. If you have chronic throat pain. If you have lymphatic nodes or any nodes that you can feel in your neck or in your armpit. If you have muscle pain or muscle cramps, if you have pain in your joints, or you have swelling in your joints, or you see them red, if you don't recover from sleep properly, or if you can't sleep at all, or you cannot go to sleep, or if you wake up in the middle of the night, or if you have weakening or any other symptoms after exertion or after doing an effort, and it happens for more than 24 hours after that exertion. So again, if you have 4 of these symptoms for more than 6 months, or if you have this chronic weakness for more than 6 months, these are the most accepted criteria for this, that it's called chronic fatigue. Again, some people say that it doesn't exist. In some medical communities, they say that it doesn't exist. I'm going to be a part of this discussion. I'm just going to mention, and just to remember, that patients really feel like this for a lot of time. And when you go and see the causes are very, very wide. Poor diet, poor sleep, the lack of exercise, the loss of muscle mass, not sleeping well, or waking up in the middle of the night, being chronically stressed for sure. If you're thinking all the time in your boss, in your spouse, in the problems that you have, and all the trouble that you have, everything is going to be affected. And of course, you can be chronically weakened because all of your autonomic nervous system in the branch of the sympathetic and parasympathetic, all of that is going to be working wrong. So you're going to start having all these symptoms. If you have chronic toxicity coming from all the things that we have today in the modern world, and also if we have heavy metals in our diet or in our life, those could be a very frequent cause of chronic fatigue. Some people have these symptoms after having COVID. A lot of people, I've seen a lot of people with chronic depression, chronic weakness that stays in patients for 6, 8, 12 months after having COVID, and they don't have the right intervention to help the body recover from this. So are there any deficiencies or insufficiencies, which is not the same? Being deficient is when your car is completely empty and you have it, the arrow is pointing in red and you already have the orange light because you have no gas at all. But being insufficient is when you have already a quarter, you have the yellow light, but you still can run for a bit. So we can have deficiencies or insufficiencies that might lead to this. When we have deficiency or insufficiency of vitamin B12, we have talked and we have mentioned in previous videos about the function of vitamin B12, that it's very necessary and important for the function of the central nervous system, but also of the peripheral nervous system. So we need to take this into account, especially in patients who are vegan, vegetarians, or patients that have a chronic bad stomach because of surgery, because of the treatment with PPIs, with medications for controlling the acid production of the stomach. So we need to be aware of this. The chronic deficiency of vitamin D, it's also related with chronic weakness. The deficiency of vitamin C, when we have a lifestyle and it's very toxic and we have chronic inflammation and we are rising on the quantity of free radicals, then good levels of vitamin C are going to help, because chronic inflammation, low-grade chronic inflammation, is going to make us feel weak. It's going to affect our autonomic nervous system for sure. Vitamin C, if I have it low, could be a problem. If I recover those levels, it could help with the balance of the free radicals, so I can be in redox balance in order to recover from all of this. Vitamin B6 is going to be important because if the cause of my weakness is because I have chronic stress, vitamin B6 is going to be involved in the process of controlling all the mechanisms in which I have an excess of the production of cortisol. So vitamin B6 in the modulation of the response of cortisol is going to be very necessary. But there are other nutrients that are involved in this. So if I have low iron or low ferritin levels, of course you're going to feel weak. If you have a chronic magnesium deficiency, which is something very, very common today, because people forget that we don't get the magnesium we should in the way that we're consuming plants today. One, because we don't consume enough plants, and two, because the soil in the plants doesn't have enough magnesium so the plant can absorb it and put it into the green leaves anymore. Why? Because the soils are being treated and because we're doing monocropping all the time. So this is something very common. Also, the deficiency in zinc. It's going to be also very related with fatigue, with weakness, with cramping, with a lot of symptoms. Deficiency in potassium, it's also related with this kind of symptoms or with this kind of weakness that people feel. Again, not to be a cause of chronic fatigue syndrome, but to be a cause of people that can be feeling chronically fatigued or chronically weak with a lot of other symptoms such as depression, anxiety, weakness, cramping, twitching, different symptoms that can be very related with this. And we need to remember also something. Most of the people in the world doesn't consume the right amount of protein. Protein is made from 20 different amino acids, from which 9 are essential and 11 are non-essential. When we have the lack of proteins, such as glycine, such as proline, tryptophan, then we are not going to be able to produce good amounts of neurotransmitters. We're not going to be able to have a good neurological function, and these are involved in multiple neurological conditions. So we need to remember that this is very important. So we have reviewed which are the vitamins that work, we have reviewed some minerals that work, we have reviewed also the function of other things such as protein and the good amino acids that we should be including in our diet. We have reviewed also which are those habits that I need to incorporate in order to not have this chronic condition of feeling weak and feeling fatigued, and also have all this kind of symptoms. Which is the best way to take the vitamins? It depends. It depends on each specific person, which is the best way to use them well. When you don't self-medicate, when you don't self-prescribe things, but when you go and take them because really you have a condition that maybe you have encountered, that you have, I don't know, a deficiency in vitamin D, then you need to be taking vitamin D. If you don't have a deficiency in vitamin D, you don't need to be taking vitamin D at all. If you think that you don't have chronic stress, or maybe you don't have oxidative stress, you don't need to be taking vitamin C at all. You can be taking it from the food that you're taking, from the veggies, from the fruits, from the good meats, the good cuts, the good nuts and seeds, eggs, good dairy. All the good food contains all of this. You only need to supplement from this when you have a deficiency or when you have an insufficiency in order to recover. Remember the example that I gave you on fuel. If you're running out of fuel, you need to refuel your car. That's it, period. So there are myths around these vitamins, and the most common myths is that everyone needs to be taking them, that everyone needs them, that you are not going to find them in food, then you need to be taking a multivitamin all the time, that the more you take, it's going to be better. And the answer for all of those is no. There are ones that you are not taking in your food, such as magnesium, and something that it brings a lot of concern today in the medical community. But different from this, you're going to find them very well if you have a good diet. So try to incorporate this. If you're feeling chronically tired, there are a lot of things that you can do. But of course, we cannot talk about all of them in this video. We just talked about some vitamins, some minerals, protein. There are other things that could work for sure, such as adaptogens, but that's not the topic of this video. So please remember, guys, before you leave, that the best way that you can support us is by sharing this video with some people. And before you leave, please remember also to hit the like button, subscribe to the channel, and to hit the bell. So every time we make a new video, you're going to be the first one to be notified. Thank you, guys. See you next time.